Hi guys, today we talk about healthcare systems and the models. The healthcare system or the models of healthcare system. How do you fend for medical cares and everything? How do you assess medical care in the society where you exist, or in the country where you are at, or where you are from? That is what we are looking at today. And not only how they are done, but we are looking at the world existing healthcare systems, right? And we want to point out some countries that practice which of them and what each of those models entails and everything. But generally, we understand that these according to World Health Organization (WHO) 1948, we understand it refers to organizations or institutions or people or resources. I'll take it again. According to WHO 1948, yes, healthcare system refers to organizations, institutions, or peoples or resources, yes, whose primary aim is to promote, restore, and maintain health in the society. Yes, that is when we talk about healthcare systems. It is the goal that is commonly achieved not only by individuals, not only by the government, but society at large. Yes, very important. So we understand that some people in society can afford the healthcare system or healthcare services, please, and some people cannot. Yes, and this is why several healthcare systems were established. Yes, yes. So several of these includes they are delineated under, you see, the one we call the single payer system, right? We are going to review the model, but I'm trying to look at the types. You see that some of the models are the one we call the single payer system. In here, only government takes care of that. We'll look at the model that gave birth to this. We'll look at it soon. Yes, and then we'll have the multi-payer system where both the government, private bodies are having hand to do provide the health services, right? And then the out of pocket, we look at that. So the second one is the multi-payer system. We have the community based, yes, community based services. And number four, like I said, is the out of pocket model, right? Now we are going to be looking at the models of healthcare system, and the first model we're going to be looking at is the Beveridge model. The Beveridge model was named after Sir William Beveridge. Sir William Beveridge, a renowned British economist, who in 1942 published the government report, a government report he called Social Insurance and Allied Services. Social Insurance and Allied Services. In his book, he proposed that national health care should be provided for all individuals and should be paid through taxation. That is by Sir William Beveridge, or Beveridge. Please, not Beveridge, Beveridge, I don't know. Okay. So, I've made the right assumption there. So, in this model, the government, as we see, provide the healthcare services. Whenever you're sick, you can go there, you'll be taken care of and everything. And not only by providing this to the society, both the staffing, the employees, or the doctors and medical practitioners that render the services, they are controlled by the government. When I say control, I mean providing the facilities, even their paycheck and everything. Yes, some countries that are under this Beveridge model include like UK, right? UK, we have New Zealand. Yes, New Zealand and Finland, they practice the Beveridge model. Yeah, excuse me. So another model we're looking at today is the Bismarck model. Bismarck, that is by a German chancellor. In fact, the German of the old Germany, the German Empire, we call it the current Germany we call today, initially the German Empire, it was named after this man, Otto von Bismarck. Yes, Otto von Bismarck, that is his name. So he was the first chancellor of that German Empire, which is today known as Germany, right? He was a chancellor between 1871 to 1898. Yes, 1871 to 1890. And that time, Germany was faced with serious economic crisis, to the extent that the citizens were unable to bear the responsibilities associated with their healthcare. He suggested in 1981 that health services should be should be provided by private bodies. People should contribute, and all of those private entrepreneurs and philanthropists should provide for that and everything. And before you know it, the legislature passed it. They passed the bill in 1983. Yes, and in this model, we understand that the health services, yes, are funded and delivered by private interventions through the money individuals pay to private insurance, such as sickness fund. Yes, people can pay to sickness fund, all of those NGOs and everything, and they render it. So through that, healthcare service can be rendered to the society, especially people that cannot afford it and everything. Government has a hand here, but majorly the private bodies through several health fund. Today we hear WHO, all of those things, and people can contribute, and they're reaching out to the persons in the society. So countries that practice this include Germany, as we know, right? We call France, Japan, etc. Yes, and we have the one we understand as, should I call it, in fact, I'm looking at this separately, but it's almost like the Otto von Bismarck model, because the national health insurance model as practiced in Nigeria. Here, there is a combination of both the beverage and a Bismarck model. Yes, here the government funds the healthcare through the money collected from taxation. Yes, while the delivery of these services is by private bodies. That's why you see pharmacies owned by persons and all of those things, and some of them is being paid by, you see, government hospitals, you see private hospitals and everything, and that is it. And in Nigeria, we practice that national health insurance, and in fact the mixture of all of those, yes, the beverage and the Von Bismarck model. So, and the one we call the uninsured model or out-of-pocket model, this is where the individuals have to, in fact, uninsured model, if you don't have money, you can't receive any health care. Yes, yes. So places like low-income countries where they cannot afford the whole services, healthcare services, the government cannot afford it. This is what they practice, and you see that it's also in Nigeria. And if you review completely the national insurance model, you understand that the government could pay the health service, healthcare service renders, but the medicine you may take sometimes are paid by your tax or paid out of your pocket. Yes. So you see that we practice that, and like I said, community health services also, we practice this in Nigeria, and that is what you see as the combination of both the beverage and the Bismarck, because there is a government intervention to an extent, and there is private NGOs and philanthropies and good well-wishers and good people trying to also put their, and also out of pocket also in action in a place like Nigeria. So you see Chad Republic, Nigeria, etc. So that is what we see in that aspect. So you will want to know that in Nigeria, the national policy was we have the Federal Act of Health. Federal Health Act was in 1988, yes, and then I think yes, we call it this the Center for Disease and Control Act. We may want to check that out also. Then other international policies, activity of the World Health Organization of 1948, yes, and the British Medical Act. Yes, so this is the size of the models of health care and healthcare delivery and activities and services, right? So thank you and see you in the next video.